So another aspect of looking at meridians is what is colloquially called the beginning and ending points. And these beginning and ending points are the actual beginning or the ending points of the 12 meridians and the conception vessel and governor vessel, the midline meridians. Now we have 6 meridians which are of the paired meridians are yin, and 6 are yang meridians. The yang meridians all begin or end on the face. The yin meridians all begin or end on the trunk. This is the simple way to be able to remember them. Each meridian, as we've introduced when we looked at alarm points, has a name. And we're familiar with names like bladder, large intestine, kidney, heart, as organs in the body. But what I want you to remember is 2 things with these, is the physiological function of the meridian rather than the organ relationship, and what it actually does, and the way it does that by altering the brain chemicals. Now, we have talked previously about bladder, and bladder meridian is associated with serotonin. And all the yang points on the face are indicative of low levels of different brain chemicals. All the yin points on the body, on the trunk of the body, are associated with excess of the brain chemicals. And the coupled meridian, each yang meridian has a couple which is yin, which is how they present on the wrists. We've talked in previous chapters about the bladder being coupled with the kidney. So the bladder in this case is associated with low levels of serotonin, and the kidney is associated with high levels of serotonin. Okay, so they're equal, but they're opposites in their neurotransmitter. But it's the same neurotransmitter for the couple. One is high and one is low, or yin and yang. So we have 6 points on the face plus the conception vessel here, which we count as a yang meridian. Now the conception vessel is associated with dopamine. Conception vessel is in the middle here, in the midline, and it's involved with structures in the midline of the body. And the most important neurological connections is the corpus luteum. Now the corpus luteum is the connection between the left brain, left hemisphere, and the right brain. And the corpus luteum has up to 13 synapses, or junction boxes, between the left brain and the right brain. And the reason for this is it slows the conversion of energy, the transfer of energy or information from the right brain to the left or the left brain to the right. And every one of those 13 is operated by dopamine. Okay, so this is why when people have low levels of dopamine, they get stuck in one brain or the other. Okay, so this is important because low levels can lead ultimately towards psychiatric problems. Now, dopamine is a brain chemical associated with the feel-good factor. When your team wins football, okay, so in other words, whether you support Manchester United or Southampton like I do, not Manchester United, when we beat Manchester United, I felt fantastic. Okay? The main reason is I get a surge of dopamine that day. Okay? When Southampton lose a match, particularly if it's against Manchester United, I get low dopamine, but most important, I get low serotonin. Serotonin is associated with bringing me back up to feeling my normal self. It doesn't give me a high. The high is a high dopamine. Dopamine is the feel-good factor. So when your team loses, your dopamine goes to normal, but your serotonin goes down. So you feel the blues or depressed about things. Okay? So the only answer is to go and have a fight, isn't it, outside the football ground and cheer yourself up, or a few drinks and try and get yourself back up. But the feel-good factor is dopamine. So people who are positive on the conception vessel have low dopamine, and they're lacking their get up and go and their feel-good factor. Okay? If they're low, if they're positive on the bladder point, they're low in serotonin, they've got more of the winter blues. So in other words, they need cheering up. They need the colour associated with the meridian, which is that violet end of the spectrum, which you don't get at this time of the year. And they need the right nutrients, cofactors involved with elevating their serotonin, which we'll go into detail on the next group of seminars. But at this point, the beginning and ending points are used for changing brain chemicals. Now, small intestine is involved here with noradrenaline. Noradrenaline gives us our real get up and go. This is our sympathetic, our flight and fright, but it's like the accelerator on us. So if you've got a small intestine positive, it means you're low in noradrenaline. And the couple to that is the heart meridian. So if you've got high noradrenaline, your heart goes bum, 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 because it's being run by the sympathetic nervous system. So noradrenaline is a neurotransmitter which can be high or low, like dopamine and like serotonin. We have in the corner and the lateral part of the orbit of the eye here, on this part of the eye, just rolling the fingers inside the orbit there, is gallbladder 1, which is associated with acetylcholine. And acetylcholine runs the parasympathetic nervous system, and it runs all the neuromuscular junctions. You remember in previous chapter we talked about the effect of solanine foods here. Now, neuromuscular junctions are all run by acetylcholine, but also our memory recall is by acetylcholine. So in the memory seminar, we'll be talking a lot about acetylcholine and how to build it and the factors that inhibit acetylcholine, because memory recall is mediated by acetylcholine. Memory input is by excitatory neurotransmitters through our eyes, ears, taste, and our 5 senses. The excitatory neurotransmitters are at triple warmer 23, which is at 10 o'clock and 2 o'clock on the orbit here, on the eyebrow. This is when they're low, and when they're high, they're on the circulation sex alarm beginning aim point, just 1 inch north and 1 inch west, or lateral to the nipple there. Excitatory ones hype us up. So a typical excitatory neurotransmitter would be aspartic acid and glutamic acid, or in artificial forms, synthetic forms, would be monosodium glutamate and aspartame. Okay? These are synthetic substances which lock onto the same receptor and fire the neurons off, and so people study and they work hard. Their eyes are working better, their ears are working better, they taste things better, they feel things better, they become hypersensitive in many ways, okay, which is great for studying. So a lot of Diet Coke helps enormously to help you to study, but at the same time the likelihood is every time you have one you're destroying a few neurons because they're firing and there's no way of getting that sodium and calcium out of the nerve. Okay? You want to try them on Red Bull. Red Bull is fantastic, really hypes the kids up beautifully, and they're awake. Your son, and he has Red Bull, which he doesn't often allow Red Bull, he's awake most of the night. Fantastic, I wish I could do that. Can't close his eyes, you know, it's like that with the Red Bull, you know, fantastic. And you think, wow, if that can do that to a youngster, what does it do to his brain in the process with it? Okay, so they're the excitatory neurotransmitter. Very, very important excitatory neurotransmitter. They operate our eyes, our visionary input, our ears, our feeling, our touch, our taste and sound. All 5 senses are operated by excitatory neurotransmitters, which we'll look at and understand why they're excitatory, because they have to depolarize and put so much information into the brain. Okay, so they're the things that hype us up. So now we're left with the large intestine, where it operates the inhibitory neurotransmitters, the ones that calm us down. So this is GABA, this is taurine, this is glycine. These are the anti-anxiety. This is where Valium, Librium, and tranquilizers work on these GABA receptors here on the large intestine. So they lock onto the same receptor as GABA would, or natural substances. So when a person shows positive on large intestine, they've got anxiety. Anxiety because they're running too fast, they've got a lack of the brake on them. So these are people who are anxious. And we've got stomach 1, which is on the bottom part of the orbit here, which is associated with histamine. Histamine is a neurotransmitter. It's an arousal. We get excited in things when we get histamine levels. So when we're low in histamine, it's active on stomach 1. When we're high in histamine, it's active on the spleen meridian. Okay, so all these neurotransmitters, we have highs and lows. And the lows are always the yang points, and the yin points are the highs. So as we go round a person, and you would do this on a person perhaps who's got emotional problems, neurological problems, certainly when we deal with the memory problems, anxieties, depressions. And you'll come back and you'll say, ah, yeah, now what was it Chris said? Is that person taking the right medication? What sort of natural remedies can we do to build serotonin? Is the drug that the person is taking, or possibly could be taking, the right one? If it's a selective serotonin uptake inhibiting drug, an SSRI drug, it's working on the serotonin level to stop the breakdown. Does this person positive on the bladder? If they're positive on the conception vessel and they've got low dopamine, it won't work. It's the wrong neurotransmitter. If, on the other hand, it's around the other way, that the person's on a tricyclic, it may work for this, but it may not work on serotonin. Okay? So you can actually work out which one is the best drug in the system through the beginning and ending points on the face and on the body. So that's something we'll look forward to when we come to neurological problems later on. So Jill, if you'd like to take our patient and run through the beginning and ending points on the face first of all. Shall we start with the small intestine? That's the one I do here on the face. This point, the small intestine, whoa, oh, sorry. I thought I'd change that. This point on the face is associated with low levels of noradrenaline. Okay, so off you go. So she's strong on that. Now we move to the gallbladder, which is, you might want to do these as you go along. So just hold on there. So touch these points as we go along. So small intestine is just in front of the tragus of the ear here and behind the head of the mandible. All right? So stick your fingers just in front of the tragus of the ear, in front of the mandible, and just chew away a bit, and you'll feel that you're on the right path. That's small intestine 19, which is the B&E point of the small intestine. Now go to the exactly on the lateral part of the orbit of the eye, and roll your finger into the orbit of the eye, and you'll feel like a little grain usually, perhaps the size of a linseed, flaxseed seed. Okay? Okay, that's the gallbladder 1. Okay? That's associated with low levels of acetylcholine. It's when people have memory problems on there. Now we'll go up to 10 o'clock on the suture between the frontal bone and the zygomatic bone there, on the orbit again, is the triple warmer. That's low levels of the excitatory neurotransmitters like aspartic acid and glutamic acid. Okay. And then we'll go to the stomach 1 on the infraorbital notch. That's at 6 o'clock if you're looking at the orbit there. Don't make sure you're not down here. It's actually in the orbit of the eye there. Good. People think they're poking their fingers in the eye. This is low histamine. Okay, now go bladder 1. Easily missed bladder 1. It's in the medial part of the orbit. Stick your finger in the medial part and then stick a little bit further in. And often you'll feel it. It's a little, when it's positive, it's like almost the size of a pea. But with most of us, it's smaller than that. So go into the corner there. You might want to close the eye and just roll your finger in a little bit more, and then you'll be on it. Okay? So those are the ones around there. Then we do large intestine. Large intestine, you follow the crease of the nostril round till you touch the bone, the nasal bone. So it's on the junction between the nasal bone and the cartilage. It's not out here that some books put. With finer and better printing, they're able now to actually put where it more accurately is, which is right around the crease of the nostril there. In the first editions of books of David Walter's book 20 years ago, 30 years ago when it first came out, you couldn't put the position accurately of where put a dot on a graphic. It was impossible on a computer, so it tended to show it was more on the lateral part. But in fact, if you follow it round, just follow the crease of the nostril round until you touch your nasal bone. Give it a bit of a rub there. Is this tender? Chances are you've got a positive one then. Okay, let's see. Okay, this often means there's a problem with the large intestine, which very frequently means anxiety from a neurochemically point of view. This is where parasites show up, when people have got large intestine problems. And then we'll get a conception vessel. Now, this is between the lip tissue and the skin. Okay, so we're not on the lip, we're just below on that tissue between the two. So off you go there. And what this will show, okay, is for low dopamine. Okay? Now let's run around the opposites, or the yin points. So we're going to do the governor vessel, which is on the top lip between the lip tissue and the skin. Okay, which is high dopamine, because that's the couple to the low dopamine. Then we're going to the kidney, which is at kidney 27, which is, if you find the medial end of the clavicle, just go on the inferior to the medial end of the clavicle, on the first interspace there is kidney 27 on one side. Just one side, although it's bilateral, we do one side. It can be either side, it doesn't matter, because neurotransmitters both sides. Okay, then we do lung 1, which is the same as the alarm point on the coracoid process of the lung, at lung 1. Okay, then we're going to do heart 1. So we're going to use the fingers and go right up the top of the armpit, and the pads of the fingers are going to be touching the posterior part of the pectoral muscles here. So you're going to go right up and just palpate in there. That's heart 1. Okay. Then we're going to go circulation sex. So you're going to visualize down there roughly where the 6th interspace is. So down towards the nipple in the male, come up 2 centimeters or 1 inch, and then lateral by the same amount, 1 inch or 2 centimeters. Okay. Then we're going to drop down from that nipple line. Halfway between that nipple and the rib cage here is the liver, between 5 and 6 rib, 5 and 6 now, 6 in space. There's the liver. So you've got a positive on the liver. Okay. And now we're going to do the spleen. So the spleen is when you bend the elbow on the side, okay, here, and you go into the crease of the elbow there at spleen 21 on the lateral part, you'll find that's the high histamine. So the liver, sorry, is coupled with the gallbladder, is high acetylcholine. So spleen, she was negative. Okay. So we've got one positive, which is a yin meridian, which means we haven't got a yang meridian. You can't have a yin without a yang. Okay, they don't exist. Okay, because it's like a positive negative. So what we've got is we've got a yin meridian, but we've got to find the yang meridian. There must be another one. So we'll go through the facial points again. Now let's have a think. The most common one to miss is the bladder, simply because people put their finger in and then they pull it back out. Okay, they don't put it in the right position. You put it in the right position, but they don't like it in there, so they pull it out. And if you're not touching the spot exactly, it won't show. So put the finger back in the eye, right in the medial part, and close your eye and push it in just a little bit more. If you do it yourself, you'll actually feel that it's deep in there. Yeah. So that's the most common one to miss. Or the small intestine, because they're too far forward. Find that small intestine one again. You know the tragus of the ear, what that is? That's this bit, not the bit you pierce. Some people pierce the tragus, and that's not good at all. Okay, so the tragus of the ear, and move your jaw around, so it's just posterior to the head of the mandible. Back, that's the small intestine. Okay, so now we've got our 2 meridians. So we've got our yin and our yang. So from that we could say, what's she expressing neurochemically at the moment is she's expressing low serotonin. It's not unusual at this particular time of the year, neurochemically wise, and the liver, which is high acetylcholine, which acetylcholine operates the neuromuscular junctions, which makes people stiff. Okay, people who are stiff and tight is because their muscles are being contracted all the time, and that's associated with high levels of acetylcholine. Okay, so they're rigid, and you become rigid in your thinking as well as a result. So that's why it's pride. You know, you look at an army who's pride. You can't march an army unless they're pride, and they're all tensed up, aren't they? Pride. Go to battle. Okay. Good, well done. So neurochemically, we found out exactly where she is by using the beginning and ending points. So now what we've learned is the beginning and ending points, and we learned the alarm points of where you diagnose where health entry possibilities are. When do you use each? As we become more proficient in future work, future teaching sessions, we'll know when to go in and use the beginning and ending points and when to use the alarm points. But I think we want to start by using the alarm points first of all. Okay, good.